Hi, my name is Christine Rayfield, and this is my video for the week 4 assessment of the nose, mouth, throat, and sinuses. And this is my patient.
Richard Rayfield, and I give Chamberlain University the rights to use this video for grading purposes.
Okay, I am doing hand hygiene and I am providing proper privacy. Good evening, Richard. How are you doing?
Good.
Good. My name is Chrissy, and I'll be your nurse this evening. Can you please identify yourself with your name and your date of birth?
Richard Rayfield, August 24th, 1991.
Okay. So what I'm here to do is an assessment of your nose, your mouth, your throat, and your sinuses. Is that okay?
Yes.
It'll only take a couple of minutes. Okay? Okay, thank you. First, I'm just going to ask you a couple of questions. Can you rate your pain from a 0 to 10? 0 being no pain, 10 being the worst pain you've ever had.
0.
0. Okay. And do you have any allergies that we need to be aware of?
No.
No. Okay. Wonderful. So I'm going to start looking at your nose, and I'm noticing that it is symmetrical with your face. The color is consistent with the rest of your face. As I'm palpating around, are you feeling any pain?
No.
No discomfort? Okay.
No.
Okay, I'm going to check your patency. So what I want you to do is close off one of your nostrils, breathe in and breathe out. Are you finding any difficulty breathing?
No.
No tenderness? Okay, do the same on the other side. Same, any tenderness or?
No.
No? Okay. And then I'm going to look up the nares. Okay, so your septum is intact. It's midline. Tubercles are pink. I'm not seeing any lesions, polyps, drainage. Good. So what I would like to do now is take a look at your sinuses. So you have your frontal ones up here and your maxillary down here. And are you feeling any tenderness when I'm palpating this area? No? Okay. So what I want you to do is close your eyes, because I'm going to be shining pretty close. I'm going to just set it right here. Can you open your mouth for me? Alright, I'm seeing a nice warm transillumination, which means that your sinuses are clear. I'm going to check this other side here. Keep your eyes closed. And same for that side. Okay, I'm going to look up here. Keep your eyes closed. Alright, that one is transillumination too, positive. This side. And same thing, so good. So your sinuses, like I said, are positive for transillumination. They're non-tender, and I don't see any swelling or edema. What I'd like to do now is move on to your mouth. So your lips are nice and pink. Can you open for me? Your tongue is nice and pink as well, along with your buccal mucosa. It's nice and moist. And it looks like you have your wisdom teeth removed. Is that correct?
Yes.
So you have 28 teeth. I don't see any missing teeth. No signs of decay. I see a crown up there, a few fillings. No active decay, which is good. What I would do now is I'd have you stick your tongue out, and then I would use a piece of gauze to move the tongue side to side to check for any lesions, anything abnormal. And then I would also check to make sure that there's no yeast, candida going on your tongue, and then lift your tongue to the roof of your mouth. Make sure that there's also no lesions or anything going on underneath the tongue, and I don't see anything. Open for me again. Say ah.
Ah.
And I would use a tongue depressor, and I would make sure that he had a gag reflex. And then I'm looking at the uvula, and that is nice and midline. Say ah again for me. And now I'm looking at the tonsils, and they are in normal size. They're not swollen. They're positive 1. Okay. And so you said your pain was a 0. Is it still a 0?
Yes.
Okay. Is there anything I can grab for you to make you more comfortable? Anything at all? Blanket?
Good, thank you.
No? Okay, thank you. If you need anything, just press your on-call button, and I'll come back to check on you.
All right.
Okay, thank you.
Thank you.
And I'm practicing hand hygiene as I exit the room.